Hello, I'm Dr. Sarah Lindberg, a naturopath in Washington, and I just wanted to share with you a service that I offer called PRP or platelet-rich plasma, which is a regenerative injection that helps so many people, but it's not quite mainstream yet. And so I just wanted to share with you what it is and see if you or anybody you know may want to benefit from this service. So I'm going to share with you my screen. And what is PRP? So PRP uses your own platelets, okay? And platelets are what are little cells that are in the immune system that stimulates blood clots and produces a scab. But what it also does is starts to bring in stem cells, which are managers of the immune system and can help to even turn into different cells that are needed in that area. And platelets help to bring those cells in. They also have 100 or more different types of growth factors involved in them, and growth factors help to actually heal and stimulate the healing of different cells in that particular area, depending on where they are put. And the immune system creates inflammation. And in this case, inflammation is actually a good thing because it's producing the cells that are needed to heal. And that is actually a good form of inflammation versus, I know in mainstream, inflammation is a bad thing, but in this case, it's actually promoting healing. So it can be a good thing. What we typically do with PRP, the procedure is relatively easy and pretty non-invasive for the most part. There's no necessarily prep for it. I usually recommend to my patients, though, not to take inflammatories a couple weeks prior, such as if they've had a cortisone shot or Tylenol or Advil or any painkillers and herbs, even like fish oil or turmeric. Those are all anti-inflammatory. So I try not to have them take those because we want to promote good inflammation in this area of healing. And also the first part of the procedure is that we do a blood draw. And what we do is we take blood into a particular type of tube that actually helps to get the platelets in a concentrated amount. And it's not very much blood. Depending on where we're injecting is how much blood we end up taking. And then we have to wait for the blood to clot. And then we put it into a centrifuge. And what the centrifuge does is basically spin off all of the platelets so that they go onto that middle or top layer of the tube because they are less dense than the red blood cells. We don't need the red blood cells in this case. And then what I end up doing with my patients, I end up giving them what it's called an NAD or nicotinamide or niacinamide injection. And it's just into the arm or your glute, and it just helps to promote more healing and make it so that the PRP takes even better. And that's optional if you guys don't want to do that. We don't have to, but it just might as well use whatever can support the body in the healing process. NAD is a activated form of B3 essentially, but it's not niacin. It just helps to stimulate the mitochondria and energy productions of each cell to function more effectively. So after the tubes are all spun off on the centrifuge, I just take off the platelets from the tubes and put it into a syringe, and then we inject the area that we are working on. And so this usually takes about 25-ish minutes. So the whole appointment is usually about 45. And then afterwards, I try to tell my patients not to take any anti-inflammatories again, because again, we're trying to help to promote the inflammation process in this case in a way that it's not supposed to be painful, like that inflammation painful. It's just promoting the healing benefits of inflammation. And so if we decrease that by taking, fish oil, turmeric, aspirin, or painkillers, that will minimize the efficiency of the actual PRP injection. And something else that I want to take into consideration, or an example, is a rotator cuff. So with this procedure and with the action of the actual platelets, it can actually help change the clinical outcome of, for example, an injury like a rotator cuff repair, and the time of the actual repair, and can prevent a re-tear because the growth factors and the stem cells are coming into play, and they can help to really heal up that area. So who is this for? Historically, PRP was made for cardiovascular surgery and helping to heal up heart surgery a lot faster, and same with dentistry. It was used in a lot of oral surgery as well. But more recently, it's been used for scar tissue or burn injuries in plastic surgery settings. In the media, it's been used with vampire facials, and Kim Kardashian kind of made that a little bit more popular lately, or for aging of skin, such as sunspots. And it can also be used for breast augmentation, which I can do all of those in my practice here because it is a relatively easy procedure. And it's also been used in professional athlete settings to, if you're wondering how certain athletes can get back on the professional scale of playing and performance, PRP has helped to accelerate that healing process. And just depending on when an athlete needs to get surgery or not get surgery, which we might get into in a little bit, you have to be able to gauge when to use PRP versus needing surgeries. Sometimes even if it's a complete tear, for an example, the surgery might be a little bit faster of healing, 4 to 6 weeks. And you can sometimes get the athletes back out. But if it's just a minor tear, strain, sprain, the PRP is used because the athletes can get onto the field faster, and the PRP can be used alongside surgery so that the athlete can heal faster. Most of the time when I use PRP, though, it's usually for a variation of pain, especially knee pain. Your cartilage tears, your meniscus tears, osteoarthritis in the spine even, any strain, sprain, injury, or chronic pain anywhere, for a dislocation to help to heal up that tissue in the labrums. I've also been using them for Dupuytren's contractures or trigger finger, when your fingers can get stuck in certain positions, or frozen shoulder, which is an inflammatory condition. But typically I don't use them for inflammatory conditions such as rheumatoid arthritis, for example, because that's already your immune system attacking itself. And so I don't typically use PRP for that. But it's also been historically used for bone fractures and helping with bone grafts. So it can be used for that. And I mentioned this as being off-label use because of how it was originally used for, and for the cardiovascular and dentistry or plastics, for example. But the FDA is not approving PRP because the FDA cannot regulate your own blood. And your own blood with PRP is not manipulated in any way, and we don't use any other ingredient in there, so they cannot regulate that. The science behind the PRP is difficult because the required testing and research is hard to do. because the composition of the blood is individualized. Everybody's blood is different, and so it is hard to actually get a good research group together. And the actual case, you have to go case by case, which does not produce a very good research study. PRP is very safe. It is not typically a concern with it. That's not why the FDA is not approving PRP. It's because it's using your own blood, right? Your body is not going to reject your own blood. And it's really hard to actually create more of an injury with even the needling if you know your anatomy. The centrifuge that is used to spin off the platelets, though, is FDA approved, so that is not an issue. And then insurance does not typically cover PRP because of the insufficient data. The off-label usage is hard to regulate, so the FDA or insurance will not usually cover the PRP. So the other choice when you're trying to evaluate whether you want to do surgery or not, a lot of people try to talk about cortisone injections. And cortisone is a steroid. And what it does is have the goal to decrease symptoms or decrease pain, and it down regulates pain. And that's what it does. It inhibits inflammation. Cortisone is really quick to having you feel a lot better because it just takes away that inflammation mechanism. But I have a lot of patients who say it does not work long-term. And the problem with it is that you can only do a certain amount of injections before it actually can start to create osteoarthritis in that joint or area that you are getting injected, because it takes away that inflammatory process completely and does not actually cause true healing. PRP enhances inflammation, yes, but I want you to pay attention to the word enhance. It's not promoting inflammation in a way that is detrimental or causing more pain. It enhances inflammation, which means it makes it more efficient and actually promotes healing and using the body's own innate ability to heal. The body is already trying to heal itself, and so the PRP is just enabling the body to do so. Time is money. And so if someone is not able to throw a ball to their kid or perform at work or live a full active life because of being in pain and wishes they could rewind the clock, PRP is long-lasting pain relief and can promote healing. So that's why sometimes it is a little bit of a slow onset, because it is actually starting to heal the body. Although some people say that they do end up having pain relief the next day. For example, I had PRP done to my ankle, and I had twisted it, rolled it hundreds of times. And this one particular time, I could not get any relief from it. And with PRP, one injection, I ran to my car that day. And I had not been able to do anything explosive off of it for about 3 months. So I found that it was helpful right away. And was I able to run a marathon afterwards? No, but I was able to run a significant difference for in a much quicker time than I would have on doing just PT. So PRP is long lasting. And so if you or somebody you know is ready to be pain-free, I offer 15-minute meet and greets to evaluate if you would be a good candidate for PRP. And those appointments can be made at www.drsayrelimbburg, that's DrSarahLimburg.com. If you have any questions, please feel free to message me or call me also, and I am happy to answer any questions that you have about PRP.